Hello, Jeremy here. I wanted to give a little introduction to this video. Just gotten back yesterday from Phoenix, visiting the Mayo Clinic, applying for the clinical trial there. If you follow me, you probably saw a few of the updates along the way as we went through the experience. But I wanted to record a little video as we went and just try to document and maybe share a little bit of the feelings that we had as we went through the different trials and through the information that we received. So this is just a little introduction. I'll try to share with you some of what we thought as we experienced it, and hopefully you enjoy being along for the ride.
All right, Heather, we're off. Tell me what you're thinking about.
I'm off to the Mayo Clinic. I'm excited for warm weather. I am going to sneak outside when Jeremy's getting tests, and curious to see what the results of the CT scan are, to see what new growths or how much it's grown and where we're at. Because it's all just a big unknown, and see if anything has changed.
So yep, we're headed off to the Mayo Clinic now. We're just getting on our drive. Show you the road as we're headed out here. A little bit of clouds, but fortunately not a big inversion or anything, so hopefully we should be able to fly fine. But headed to the Mayo Clinic.
Everything I touch will break. And every day you give and I take. I'm living the best.
All right, first night in the books. We are in Phoenix. We've already been to the Mayo Clinic and did the first labs and signed all the documents. We had to hurry from the airport straight there, but it was really quick actually once we got there.
Well, we already had read all the papers, so you just had to sign on the dotted line.
That's right. So it was quick, relatively. Got poked a bunch, had to give all the bodily fluids for the tests. And then, fortunately nearby was a little mall here where we had dinner. We were able to spend a little time together. It's nice at least to be in some warm weather and be able to enjoy this time together while we're going through this process.
The best that I can, but fate never followed my plans. I'm holding you back, so I want you to pack up and grow.
First test of the day done. It took all of 5 minutes once we got in there, so that was a lot quicker than we thought. We're now transferring buildings, going to Scottsdale to the next clinic. The next one up is the MRI. So right now we just finished the electrocardiogram. That was super fast. It seriously was like they hooked me up and he said, oh, there you go. All right, we're done. So on to the next.
Everything you've done is great. But your back has been feeling exhausted from all of the weight. I'll carry this burden myself. Just put me up high on a shelf. Think of me fondly, but please move beyond.
All right, we're just out of the hospital. We've done a full day of testing, and we met with the clinical trial director and then the doctor, and they had all the scans done and ready, so we got to see what was on there. And
Which was super fast.
Super
That's
fast.
never been that fast ever.
No, it always takes
nice.
days to get that. So that's good that we got it fast, but the news wasn't good. Not entirely unexpected, but
We're pessimists at heart.
yeah, we go into it knowing that this is a bad situation, and so we know it's not going to be great news necessarily, but you go in with that little bit of hope, you know, that little bit of hope that maybe it's not that bad, or maybe some of the things you've done have helped slow it down. But in this case, the news was it exceeded expectations in the wrong direction. So it's a lot worse. The cancer has spread into a lot of different places. Those that were present are more than double the size than just 3 months ago. So the rate of growth that we're seeing right now is more than we saw even the entire time before my surgery before.
So your biggest tumor is 13 centimeters now, and then you have a bunch of 7.5s.
And one's in the adrenal gland. You've got it on the top of the liver. There's some between the liver and the kidney, throughout the omentum.
Stomach.
Yeah, it's blossoming in a not a good way. So that's disappointing. It's not the news we wanted to hear. But at this point, you know, it's information. We try to work with what we know and try to look forward. So at this point, what we're waiting for is they will now submit all these findings to the pharmaceutical company that's sponsoring the trial. It's pretty obvious from our perspective, at least, and even from the doctor's perspective, that we tick all the right boxes.
Oh, you should put in there, it's not operable. Like, there's no way to operate to remove these anymore.
The requirements of this trial are first that you've failed the first 2-tier drugs, which is Gleevec and Sutent, which I had already done. The second is that you are either inoperable or it has metastasized and spread. And I hit both those boxes. Basically, surgery is not an option at this point. It's just too spread. The benefits wouldn't be there. You'd have to reduce quality of life in such a way to even try and get it out. And showing how it's growing, unless there's a drug that interferes with it, it's just going to continue to grow. So they would not recommend that. So we qualify in all those respects, but it's still, you know, up to their purview to say that I am eligible for the trial or that I'm a good candidate for the trial. So we wait to hear.
And then you come back next week.
And I have to come back. So apparently, we thought maybe this could, I could receive the drug or some of the tests could be done locally. That's not the case. So I may have to be back here as soon as next week if they accept me, and then
every 28 days.
28 to 29 days after that. It's a 28-day dispensary cycle. They have to actually watch me take the first pill in person, which is really kind of weird, but it is what it is.
And then CT scans every 6 weeks, but they're going to try to make it all mesh together.
Yeah, so a CT scan every 6 weeks, which is a whole lot of radiation, but I guess that's kind of the least of my concerns at this point. But yeah, the question is how much can they mesh those visits together?
And you don't know which drug you're taking still.
Yeah, and until they accept me, I still have to have the computer randomizing whether I take the 3rd-tier drug or if I'm on the trial drug. So those are all, we have more information, but now we wait again for more information. But what's your takeaway here?
Just keep going and come back next week.
Yeah, we just kind of try to keep looking forward. Like I said, the information, it's tough not to walk out there and feel discouraged because there's some discouragement to it. That's reality. And, you have to take that information in and just see what you can do next. Try to take the positive that we are, here applying to be a part of this trial, that this drug may have benefits for me. It's entirely possible. Given the history, I'm showing a mutation profile that's very aggressive and resistant. So that tells me that, we definitely got to try, but there's a good chance that this may do some good, but not necessarily everything that we hope again. So we'll keep trying. And
some people it's really helped. So
yeah, some people
we'll
it's provided benefits, so we can hope for that and keep moving forward. But we wanted to record this just right as we left and kind of give a little bit of an impression of what we're thinking right now. But next step is we're going to go get some food and go enjoy a little bit of the sun here in Phoenix. So if we have to be down here, we might as well enjoy some of it.
Just waiting for you, but I'm holding you down from the dreams that you found in a life that you left when we met. So please just escape before my resolve goes away, and I ask you to stay.